Good morning. I'm Dr. Ghazala Ali. I'm an obstetrician and gynecologist working in Aster Clinic, Butina, Sharjah, in UAE. Today I have chosen a topic of ectopic pregnancy to discuss with my audience, especially the female audience, because I think this is one of the disease which I think all the women should know about it. Why I have chosen this topic, there's a reason behind. Before working with Aster, I was working in Al Qasmi Hospital, which is a very busy government hospital in Sharjah, as an acting consultant, and there I saw many women coming in a very bad situation, suffering from ectopic pregnancy consequences, and we have to save their lives by doing surgeries. Therefore, I feel they have reached up to that stage because they were not aware of their situations and they have not reported early. Therefore, I want to make all the women aware of this situation, and they should know when they have to report to their doctor. Now, what is ectopic pregnancy? Actually, I think all of the women, they must be knowing that the pregnancy happens inside the uterus. But sometimes about 1 to 2% of the cases it can happen outside the uterus. Therefore, it's called ectopic pregnancy, that is, it's away from its place. Now, when it happens outside the uterus, it means it can happen in most of the time it happens in the tubes, fallopian tubes. You must be aware there are two tubes attached to the uterus. So it can happen in one of the tube, and it's called tubal pregnancy. Sometimes it can happen inside the abdomen and in the ovaries or the cervix, but the tubes is the most common place. Therefore, it's called tubal pregnancy also. Now, when the pregnancy happens outside the uterus, it goes into the tube, and tube is not the right place for the pregnancy to develop. Therefore, after a certain time, that is after 8 weeks or 10 weeks, it bursts, it causes lot of bleeding and inside the abdomen, and the patient's life is endangered. So that's why the question is why it's so important to be aware of this condition of ectopic pregnancy, because it has a serious consequences for the woman's life, including she can go up to death if it is not diagnosed accurately and on time. Now the next question, what are the causes of ectopic pregnancy? So anything which damages the fallopian tube can cause the ectopic pregnancy. How it can be damaged? The most important cause is the infection of the fallopian tubes, which is called pelvic inflammatory disease. That can do the inflammation and infection inside the tube, thus making it blocked. Therefore, when the gamete come over there, it does not allow the gamete to pass into the uterus, and it stucks up there. Now, the second cause of of damaging the fallopian tube is the surgery on the fallopian tube. Sometimes the woman goes for bilateral tubal ligation, where there is a surgery on the tube which damages the lumen of the tube. Or if there is a surgery and they have got the recanalization of the tube. In that situation, the lumen of the tube is damaged, and therefore the gamete is stuck and it goes for ectopic pregnancy. Similarly, if the woman has undergone pelvic surgery or abdominal surgery, then that can lead to adhesions. Therefore, meeting both the fallopian tube with the abdominal viscera, like intestines, uterus, bladder. In that situation, also the tube is damaged, therefore leading to ectopic pregnancy. Now, in some situations, nothing happens like this, but by genetically the tubes are long and tortuous, therefore are taking a long time for the gamete to pass through it, and which increases its chance to stuck up in the tube, and it gets an ectopic pregnancy. Now, who are the women who are at risk of ectopic pregnancy? I think all the women should know their risk factor about it. So first of all, the woman who has suffered pelvic inflammatory disease, that is the inflammation of the tube or infection of the fallopian tubes, they are the one who are at high risk of developing ectopic pregnancy. Similarly, if they have a history of ectopic pregnancy, like in the last, say before 3 years she has an ectopic pregnancy, after that she have a normal delivery, and then again she is still at risk of having ectopic pregnancy. So the previous history of ectopic pregnancy is also a risk factor. Similarly, a woman who is using a contraception which is called POP, that is progesterone only pills like Sharjah and other pills, that actually decreases the motility of the tube, therefore making the gamete to stay a longer time in the tube and predisposing to become an ectopic pregnancy. And the women who are using like intrauterine contraceptive devices, they are also at high risk of developing ectopic pregnancy. And those women who are going for the treatment of in vitro fertilization treatment, which in layman terms we call it test tube baby. If the women are going for infertility treatment and they have undergone IVF, they are also at high risk of developing ectopic pregnancy. Similarly, if the woman who has undergone pelvic and abdominal surgery, as I told earlier, they are also at risk of developing ectopic pregnancy. Therefore, the women, if they are having any of this risk factor, they should be very cautious, and when they miss their period and their pregnancy test is positive, they have to go and report to the doctor to see whether the pregnancy is in the right place. Now the next question is how it is diagnosed. Actually, diagnosing ectopic pregnancy is not difficult. It's just a blood test and ultrasound. But the main thing is it has to be done at a very early stage. Like the woman should be aware when she has to report, then the diagnosis is not a big issue. Now, once we have diagnosed the ectopic pregnancy, the next question comes in mind that how it is treated. And this again, I will say here the time is very important. If the woman has reported early and the pregnancy has been diagnosed at a very early stage that it's an ectopic pregnancy, then we have a chance to treat the woman in a very safe way with an injection, one injection intramuscularly, and she will be getting rid of ectopic pregnancy. Rarely she needs a second injection. But if the woman is not aware of her situation and she is not aware that such a condition can happen, and she reports to the doctor at a later stage when the pregnancy has already developed up to 8 weeks, 10 weeks or 12 weeks, where the tube is unable to handle that and it bursts, and she comes with a lot of bleeding inside her abdomen in the state of shock, means then the surgery is the treatment. So in early stage reporting, we can treat with injection, very safe. She can go home and she's like a normal person. But if she comes late and it's already ruptured, then we have to go for surgery. Now this is another situation whether the surgery has to be by laparotomy, that is a conventional surgery, or it has to be laparoscopy. There are many factors to decide about that route of surgery, so that will be according to each and every patient we assess and we decide about it. Now, having all this information, what are the things which women can do to protect herself from this ectopic pregnancy, and if it happens, to reduce its seriousness? The first of all, women should be aware of the situation that there is something called ectopic pregnancy, so she should know about its consequences. Number two, the main important thing is that she has to have a very healthy sex habits. She has to be a single partner person. She has to stick with her husband or her partner, and if the partner is a multisexual person, then she must use condoms to protect herself from this situation, to have infection which can lead to pelvic inflammatory disease, which in turn can increases her risk to have ectopic pregnancy. Then second thing is, if any stage of her life she feels that she's having a lower abdominal pain and some infection, and she has difficulty in passing urine, and she's having fever, she must think then there might be a chance of having pelvic infection, so she should report to the doctor, get herself assessed and treated. And it's very important that her partner should also be treated, because otherwise he can reinfect her, and the early treatment has a very beneficial effect, that it avoids or it prevents or decreases the chance for blocking the tubes. So if we are able to stop that blocking of tube, the chance of ectopic pregnancy is automatically decreased. Similarly, the women who are using intrauterine contraceptive device, that is loop, or in layman terms we call some women call this loop or IUD or something like that. So those women, as you must be aware, that it prevents pregnancy. But if pregnancy occurs, then the chance of having ectopic pregnancy is very high. So a woman who's on IUCD, she should, if she miss her period, she should immediately report to the doctor to see whether she's pregnant or not, and if she's pregnant, what is the location of this pregnancy, so that she can be treated at an early stage. And similarly, if she has disturbed periods, sometimes women complains that this is her due time for period, but it came very little, and after few days again some bleeding, after few days some again some bleeding, and she took it as normal period. No, this disturbed period has also to be evaluated, and the first thing to do a pregnancy test to see whether she's pregnant or not, and if she's pregnant, to see whether it's a pregnancy inside the uterus or not, so that the early diagnosis will save your life. So it's very important. Now you might be thinking that after once having an ectopic pregnancy, is it possible for you to have a normal pregnancy in future? Well, this depends again on the situation. If we are able to save your tube, like if a woman reports early and she is diagnosed early with before the tube has been ruptured, then we can treat her with injection, and we are in like the chance of saving the tube is there. So therefore she has a great chance to have a normal pregnancy later on. But if she has reported in a later stage where the tube has already bursted, then we have to remove that tube, and she's left with one tube, and her further pregnancy chance depends upon the situation of her only remaining tube. If it's patent, then she has a great chance to have a normal pregnancy, but if it's blocked, then she has a high chance of having ectopic pregnancy in the remaining one tube. So the situation all varies from patient to patient. Similarly, so if we have, like, again the thing, if you have reported early, you have diagnosed early, you have been treated by injection or by laparoscopy, and your tube has been saved, so you have a great chance to have normal pregnancy. And but if you have one ectopic pregnancy, please keep in mind your chance of having ectopic pregnancy is higher than the other women, so you have to report and get diagnosed yourself. And I think having all these things, then another question arises: do I have the facility to be diagnosed early, like in UAE? What are the facilities available? Well, as all of us are aware, that healthcare sector is very well developed in United Arab Emirates, and almost every clinic, every hospital has the facility to diagnose it. But the only thing, the patient should be aware, and she has to report early to have the best outcome of this disease. So thank you very much. If you have any questions, you can post, and inshallah I will just answer that.